In St. Louis, Missouri, thousands of people waited in line for something increasingly rare: free, complete medical care. Led by Adventist volunteers, a convention center was transformed into a fully functioning medical center, offering care that went far beyond exams and diagnostics.
For 4 days, more than 2,000 volunteers and health professionals provided free care to thousands of people in downtown St. Louis. The clinic, part of the Pathway to Health project, required no insurance, documents, or ID. The lines wrapped around the block. Some said they arrived before dawn. Among the volunteers were cardiologists, surgeons, dermatologists, physical therapists, and general practitioners, treating conditions many had waited years to address. Services included cardiology, women's health, pediatrics, dermatology, minor surgeries, eye care, and dentistry. In some cases, patients underwent procedures and walked out with new prescription glasses, regaining not only their sight, but also their independence. Beyond clinical care, volunteers offered therapeutic massages and haircuts, small gestures that restored dignity and self-esteem. Clothes and shoes were also distributed, essentials for those who often arrived with nothing more than what they were wearing. Many gave up a day's wages just to be seen, a chance they couldn't afford to miss. One volunteer, who's been part of the clinic since 2009, keeps coming back. For her, service is the greatest reward.
So one of my favorite parts about Pathway to Health is the opportunity to pray with patients. You never know what they need and how God can touch them when you pray with them. And so I just prayed with a family. He had it was a dad, and he had a daughter and a son. And after I prayed for them, he said, "Can I pray for you and for the people who are working here?" And he just now gave the most beautiful prayer. He just prayed for God's hands to be on all of us, and that we would be blessed because we are blessing them, and that the community that we're serving really needed this. And so he asked for God to really bless us abundantly because we're here serving them. And that really touched my heart.
2 men, one aged 34 and the other 50, had their very first eye exams at the clinic. They left emotional, waiting to receive their first ever pair of glasses through a local church. For one woman, the experience marked a turning point. She said her life now feels divided into before and after the clinic.
I went to medical. Went to internal medicine first, right? Got a chance to see that doctor for free. I think I must have got about $20,000 worth of work done, absolutely no cost, because I don't have health insurance, family. So therefore, this is a miracle for me.
And for those who came, the impact is clear. This wasn't just a medical outreach. It was an act of faith, compassion, and hope. But the care doesn't end here. Local Adventist churches will now become community health centers, offering free wellness classes, natural cooking, and chronic disease prevention. This initiative also sets the tone for the upcoming 62nd General Conference session of the Seventh-day Adventist Church, happening from July 3rd to 12th, also in St. Louis. The global gathering brings leaders and members together to make spiritual and administrative decisions. But before the meetings begin, the message is already clear. The church came first to serve.